Welcome to Family Vlogs. Join me as I shed light on Helicobacter pylori and peptic ulcer disease. Watch this video till the end. Subscribe, like, comment, and share. Thank you. And let's do it. Let's roll. Helicobacter pylori, we are going to look at the definition of Helicobacter pylori, how it is being transmitted, peptic ulcer disease in details and causes of it, and of course we are going to look at the risk factors of peptic ulcer disease, signs and symptoms of peptic ulcer disease, and of course we are going to tackle in details complication of peptic ulcer disease, laboratory investigations, diagnosis, management or treatment, and how to prevent peptic ulcer disease and Helicobacter pylori. Now, Helicobacter pylori is a gram-negative bacteria. It grows in the digestive system, penetrating stomach lining, leading to digestive juices to leak and damage the stomach lining, causing inflammation. And this is a brief diagram of how Helicobacter pylori look like in the stomach. Now, Helicobacter pylori produces large amount of urease, and this results into ammonia, and as one of its adaptation to overcome stomach acidity. Remember, Helicobacter pylori is the #1 cause of peptic ulcer disease, and this is what we are going to tackle into details. Transmission of Helicobacter pylori is very important in this discussion. And how do we contract Helicobacter pylori? Let's see on how we can tackle this in the next slide. Transmission of Helicobacter pylori, #1 way is through fecal oral route, and this can be caused by when we eat food contaminated with fecal matter, poor hygiene, pollution of soil and water with fecal materials, and this is what might bring and what might cause this Helicobacter pylori. And #2, we have direct contact with saliva and vomit. As I've said earlier, Helicobacter pylori is #1 in causing peptic ulcer disease, and we must put this into consideration. Now, Helicobacter pylori causing peptic ulcer disease, we are going to look at categories of peptic ulcer disease. But before that, let us define peptic ulcer disease, which are sores that develop in the lining of the stomach, lower esophagus, or small intestine. And we have 3 types, that is gastric ulcers affecting the stomach. We have esophageal ulcers affecting the esophagus, and last but not least, duodenal ulcer affecting the duodenum. Now, causes of peptic ulcer disease, as I've mentioned earlier, the #1 cause of peptic ulcer disease is Helicobacter pylori. We have also non-steroidal anti-inflammatory drugs like brufen, diclofenac, and indomethacin playing a great role in causing peptic ulcer disease. The risk factors of peptic ulcer disease are smoking, drinking alcohol, untreated stress, eating spicy food. Signs and symptoms, of course, patient will present with dull pain in the stomach, heartburn or acid reflux, bloating or feeling of fullness, passing of excessive gas, pain improving after eating or taking anti-acid. Remember, don't take too much anti-acid because it normally just masks the symptoms. Now, complication of this disease is bleeding, and this bleeding may bring loss of blood to the digestive tract and may cause anemia. and you will have black sticky stool like tar, and then you are vomiting. You will be vomiting blood, which is coffee ground. Of course, second complication is perforation. Occurs when an ulcer eats through the wall of the stomach or intestine into the abdominal cavity. When perforation occurs, partially digested food, bacteria, and enzymes from the digestive tract may spill into the belly, that is the cavity, causing inflammation, and this will result in peritonitis, which may warrant surgery. Gastric outlet obstruction is the third complication, and in some cases, peptic ulcer can produce inflammation, swelling, or a scar tissue that can obstruct the normal passage of food through the digestive system. This is known as gastric obstruction. Gastric obstruction occurs in an estimated of 5 to 8% of cases of peptic ulcer disease. Now, diagnosis of this disease is by 1. Laboratory investigation. We'll take blood for antigen of H. pylori and stool for antibody. Then there's a breath test where you swallow a pale liquid or pudding. You then breathe into bag. H. pylori, if present, the urea that we breathe will be converted into carbon dioxide. That is done in the lab, and the answer or the test result will be positive. Of course, we'll do endoscopy and biopsy, and after GI series, that is barrier meal or swallow, that is done through X-ray, and then of course CT scan can also be done to check the ulcers. Of course, treatment and management of this disease is standard management is the use of PPI and 2 antibiotics, that is proton pump inhibitors plus antibiotics. A period of 14 days is very necessary. So you can either use PPI, either omeprazole 20 milligrams for 14 days and take twice in a day, or someprazole 40 milligrams twice in a day for 14 days. Antibiotics, clarithromycin, metronidazole plus amoxicillin as indicated. Now, how do we prevent this disease? 1, we should be able to know what are the risk factors and what might have caused Helicobacter pylori. Now, 1, you avoid non-steroidal anti-inflammatory drugs, which are brufen, diclofenac, indomethacin, etc. And then, of course, hand washing is always key with running water and soap. Drink clean water, which has been treated or even boiled. It's very necessary. Avoid contact with vomiters or saliva, and do physical exercise, and this normally bring the happy hormone called endorphins, and this one helps us to avoid stress. Avoid smoking or drinking alcohol. Use fresh onion, cabbage, and garlic in your food. Thank you for watching, and of course, if you have not subscribed to this channel, subscribe, like, and share. See you in the next video. And of course, because you've stayed here and watched this video, this is much love from me, and let us share, subscribe for more videos that I will post, and turn on the notification bell for more videos to come.